Hi everyone, as an immunologist, I'm very interested in different conditions that affect the immune system. Today, I'm here with my good friend Micah, MD, specialist in rheumatology. Micah, can you tell my audience what sort of conditions a rheumatologist specializes in and what are some common challenges for your patients?
Hi Andrea, thanks so much. I specialize in the treatment of rheumatoid arthritis and systemic lupus erythematosus. These are both conditions that cause immunological changes to occur that can affect my patient's ability to fight infections. The treatments we use for RA and SLE can also suppress a patient's immune system and further curtail their ability to fight infections. This is why I advise my patients on the importance of vaccines in helping to prevent serious infections, as well as the timing of vaccines administration when starting on therapies for RA and SLE.
So Micah, with flu season here and a recent global pandemic, is it safe for RA and SLE patients to receive vaccines?
Yes. While sometimes a physician may temporarily stop their immunomodulatory therapy or delay starting it to administer a vaccine, other times a physician will continue therapy because stopping it could be detrimental to the patient's health.
I see, yeah, that makes sense.
Typically, patients may receive non-live vaccines such as the flu vaccine, excluding the nasal mist form, of course. Vaccines for COVID and RSV are recommended in certain populations that are immunocompromised or with certain conditions. The CDC also recommends the shingles vaccine to prevent shingles and related complications in adults aged 50 years or older, or adults aged 90 years or older who are or will be immunodeficient or immunosuppressed.
Micah, I'm so glad you mentioned shingles because anyone previously infected with the chickenpox virus, also known as the varicella-zoster virus, can get shingles. I've personally had shingles, and let me tell you, it was terrible.
Oh my gosh, I need to tell you that I had shingles too, and it was the worst feeling ever. And did you know that an estimated over 9 million people in the US are at risk for herpes zoster due to rheumatic diseases? And compared to individuals without rheumatic disease, the incidence of herpes zoster increases in adults with SLE, RA, or PSA.
Wow, that's a lot of people.
That is a lot of people. And did you know that women have up to a 5-fold increase in risk for SLE and RA compared with men?
Yeah, I know. And women are more prone to getting shingles.
Exactly. And we know immunosuppressive therapies used to manage rheumatic conditions may increase the risk of herpes zoster. We also know that people who are immunosuppressed can experience more severe symptoms of shingles and are at risk of developing complications like post-herpetic neuralgia, which causes nerve pain that can last for months or even years.
Speaking of that, Micah, I recently learned that while hospitalization is not that common for patients with shingles, about a third of people who are hospitalized with herpes zoster have compromised or suppressed immune systems. Do you see complications from shingles in your patients?
Yeah, I definitely have seen complications of herpes zoster, including post-herpetic neuralgia.
So Micah, what do you recommend?
Well, prevention of the reactivation of the herpes zoster virus is the only well-documented means of preventing shingles and its complications. And the CDC does recommend the herpes zoster vaccination for the prevention of herpes zoster and related complications in immunocompetent adults aged 50 years or older and in adults aged 90 years or older who are or will be immunodeficient or immunosuppressed because of disease or therapy.
This is all such great information to get out there, Micah. Thank you for coming here and sharing your knowledge and expertise with my audience.
Andrea, you are so welcome. I had such a great time talking to you today.